Artificial intelligence doctor. User question. What are the specific mechanisms by which liquid buildup in the lungs, pulmonary edema, contributes to orthopnea and nocturnal asphyxia in elderly individuals with underlying heart conditions? ChatGPT. Thought for 19 seconds. Introduction. Pulmonary edema is a condition where excess fluid accumulates in the lungs' interstitial spaces and alveoli, leading to impaired gas exchange and breathing difficulties. In elderly individuals with underlying heart conditions, this fluid buildup significantly contributes to orthopnea, difficulty breathing when lying flat, and nocturnal asphyxia, severe shortness of breath during sleep. Understanding the specific mechanisms involved can help in managing and treating these symptoms effectively. Mechanisms by which pulmonary edema leads to orthopnea and nocturnal asphyxia. Increased hydrostatic pressure in pulmonary capillaries. Left-sided heart failure. One of the most common underlying heart conditions causing pulmonary edema is left-sided heart failure. When the left ventricle fails to pump efficiently, blood backs up into the left atrium and then into the pulmonary veins and capillaries. Fluid leakage. The increased pressure forces fluid out of the pulmonary capillaries into the interstitial spaces and alveoli. Breathing impairment. The presence of fluid in the alveoli reduces lung compliance and hinders oxygen uptake, leading to shortness of breath. Effective body position on venous return. Supine position challenges. When an individual lies flat, gravity causes more blood to return to the heart from the lower extremities. Increased preload. The increased venous return, preload, overwhelms the already compromised left ventricle, worsening pulmonary congestion. This leads to further fluid accumulation in the lungs, intensifying breathing difficulties when lying down, hence orthopnea. Redistribution of extracellular fluid. Fluid shift during sleep. At night, especially during sleep, fluid that has accumulated in the legs during the day due to gravity and decreased mobility redistributes centrally. Pulmonary fluid overload. This central fluid shift increases pulmonary capillary pressures, exacerbating pulmonary edema. Nocturnal symptoms. The fluid shift contributes to nocturnal asphyxia, causing individuals to awaken suddenly gasping for air. Paroxysmal nocturnal dyspnea. Reduced diaphragmatic efficiency. Abdominal pressure increase. Lying flat can increase intra-abdominal pressure, pushing the diaphragm upwards. Decreased lung volumes. The elevated diaphragm reduces lung capacity and functional residual capacity. Respiratory muscle fatigue. Over time, the respiratory muscles tire, making breathing even more laborious in the presence of pulmonary edema. Impaired gas exchange. Alveolar flooding. Fluid in the alveoli creates a barrier to oxygen and carbon dioxide diffusion. Hypoxemia and hypercapnia. Low oxygen and high carbon dioxide levels in the blood stimulate rapid, shallow breathing. Dyspnea sensation. The body's response to gas exchange impairment intensifies the sensation of breathlessness, especially at night. Altered respiratory control during sleep. Cheyne-Stokes respiration. Heart failure can lead to a periodic breathing pattern characterized by cyclic waxing and waning of respiratory depth and rate. Central sleep apnea. Fluctuations in carbon dioxide sensitivity during sleep can cause periods of apnea, breathing cessation. Nocturnal asphyxia. These breathing irregularities contribute to nocturnal asphyxia, disrupting sleep and oxygenation. Neurohormonal activation. Sympathetic nervous system stimulation. Heart failure triggers sympathetic activation, leading to vasoconstriction and increased heart rate. Renin-angiotensin-aldosterone system, RAS, activation causes sodium and water retention, increasing blood volume. Fluid overload. The resulting fluid retention exacerbates pulmonary congestion, particularly noticeable when lying down. Age-related physiological changes. Decreased cardiovascular reserve. Aging reduces the heart's ability to respond to increased demands. Stiffer blood vessels. Reduced compliance of blood vessels leads to higher pressures transmitted to the pulmonary circulation. Impaired lymphatic drainage. Aging may affect lymphatic removal of interstitial fluid from the lungs, promoting edema. Conclusion. Pulmonary edema contributes to orthopnea and nocturnal asphyxia in elderly individuals through a complex interplay of cardiovascular and respiratory mechanisms exacerbated by underlying heart conditions. Increased hydrostatic pressure in pulmonary capillaries leads to fluid accumulation in the lungs. Body position changes during rest and sleep worsen this condition by increasing venous return and redistributing fluids centrally. Additionally, age-related physiological changes diminish the body's ability to cope with these stresses. Understanding these mechanisms is crucial for effective management, which may include medical therapies to reduce fluid overload, positional strategies to alleviate symptoms, and treatment of underlying cardiac dysfunction.